Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest is Julia Goebel. She's Chief Marketing Officer at Komodo Health. Welcome, Julia.
Thank you, John. It's great to be here today.
Yeah, great to have you back. We've had you on a few times.
That's right.
Yeah, we've been friends for a long time.
Repeat visitor, yeah.
Yeah, but tell me a little bit about yourself and Komodo Health for those that don't know you.
Absolutely. So I'm Chief Marketing Officer of Komodo Health. We are a technology company setting the evidentiary standard for real-world data in healthcare. On average, we have 330 million lives, which represents the U.S. healthcare system. And we help our customers realize a velocity advantage.
Well, and I think it's interesting, Komodo Health has such a vast amount of data that they can make available to healthcare organizations.
Indeed.
What do you say are maybe the three most common challenges you hear from healthcare organizations when they're trying to leverage technology and the real world data that you have available to support the decision making they need?
Well, I'm smiling because every organization has its own challenges. It may be readiness, it can be resources, it can be the constraints of change. And while we know that change can be a challenge, we also recognize that the early movers have an opportunity to shine. And so one of the examples I look to is where can we surface healthcare cost data that helps an organization better understand how they compare to peers? Where can we identify the benefits of therapies, first-line treatment, second-line treatment in the case of oncology, for example? There are ways that these can help, in the end, advance patient care. And we know that wherever an organization is in its evolution, whether it's the pressures of costs of workforce or migrating and adapting to new systems, there is a way to innovate even in small incremental ways.
Interesting. You know, I think we've seen a huge evolution in healthcare of leveraging the data, right? You know, I think that's good, and it's good that we have more data. But how do you see the role of real-world data evolving in healthcare decision-making over the next 5 years? Like, we've come a long way, but where are we headed, especially with the rise of all the AI-powered tools that are coming? You know, the show floor here is full of them.
You can't walk or shake a stick without hitting AI. And what's interesting is that it will continue to rely on the quality of the data underlying it. And so whether you are a marketer and you're thinking about how does my organization better show up in SEO results, original content is part of that, trusted information is part of that. The same is true in the clinical setting, in life sciences and medical devices, in digital health. The quality of the underlying data will drive the outcomes of the LLM or the AI solution. And so we firmly believe at Komodo that quality data is going to continue to lead the way.
That's interesting. Is that one of the big drivers for the business at Komodo, is that you have quality data and they want to use some new AI tool, but they need better quality data?
The basis under which we build our AI tools is the healthcare map. Dozens of sources come into that, which allows us to see on average 7 years of patient journeys. And so as a result, we think that our AI solution is advantaged differently than ones based on other data sets.
Interesting. You know, there's a lot of attention on health equity as well. You know, it's a popular topic for us here. How can technology platforms like Komodo's help bridge the gaps in care and address the underserved populations that are often represented in these health equity data?
Industry will lead the way in this regard. The industry wants to meet the needs of as many patients as possible.
Yeah. So where can people go to learn more about Komodo Health and all the various data that you have available to help enable them in their efforts?
Absolutely. Please go to komodohealth.com, and you can always reach out to any of our team on LinkedIn. We'd be happy to connect. Awesome.
Thanks so much, Julia. I appreciate you taking time to talk with us and share all these insights and perspectives about real world data and how healthcare organizations can use their data. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Julia.
Thank you.